So the next topic will be just a kind of evaluation method. I'm not sure if all of us are quite interested or not. So just enjoy your coffee or enjoy your rest. I will simply introduce this. Actually, we already published this spring for our small study about the comparison of quantitative evaluation and conventional scar scale analysis for pediatric pathological scars. When we so the whole study we designed like first the image from the camera and also dermoscopy and also enter 3D imaging system. And sometimes we simply, I mean, from the start point, we do this the three parts of the evaluation, and also before we evaluate the effectiveness. So from weighing to measuring, this is quite challenging, I think. Before, we always use the Vancouver score or other POSAS score. So this is quite, not so comprehensive. You don't have the quantitative data. And later, just like there is a joke, I don't know if you used in ancient time, how to measure the weight of the elephant. We have the tell story. It's that there is a very smart boy. So the elders, when he saw his father was discussing the methods for this topic with his friends. So he generated the idea that why not put the elephant on the boat and then see how the boat to dig in the water, and then you put the same weight of the stones, and then later because for stone it's easy to take the weight, to measure the weight. So we call it a very smart boy. That's our ancient story. By the way, I will tell a joke from my son. So when he was like 6 or 7 or something like that age, so I was asking him the same question to see if he is smart or not. You know what's his question? And so how to weigh the weight of the elephant? You know what his answer? Okay, he said, just cut it in pieces and you are going to have the weight. Okay. I was so surprised. What? You bad man. So I go back to our clinical problem. So pediatric scars need very, very intensive and objective monitoring. Like this is not too as like severe as I showed before. And it's most of them is after surgery, like after nevus. When we get rid of the nevus in this kind of parts close to the adjacent joint adjacent area, so you are going to have hypertrophic scars like here after skin transplantation, but here I think this must be keloid. Am I right, Michael? Yeah. Okay. So this one keloid. We are going to have those problem, but how to tell other people, not only from the eyesight. So okay, this is much higher, but how much? So we need the scar assessment. That's why we bought this machine. It's a kind of a new assessment tool. This is called Enter 3D. Actually, they have like 9 parameters. So this is about the volume and also the the color, and sometimes if it's lower than the skin, and then you have when we look here. Oh, sorry. Where's the laser again? So this part, we have the. Okay, thank you so much. So when you need the laser, just call for help. This lady is very smart. Thank you so much. Okay, now we have. Okay, we are having here. So here we have the different quantitative data, and later, the smart one, he will give you not only the later he will give you a curve. With time. So this study, we used 35, and the patients followed like 18, and we have 36 scar regions. And let's go to the, as I mentioned, it's a pre and post comparison, and we have the CVNSD. Of course, we always have this. So this is one of the hypertrophic scar. I'm sorry, because we have more hypertrophic scar for pediatrics patients, much more than keloids. So this is just a sample. So we can see here, this is the dermoscopy, and here 3D. We have the pigmentation, vascular, and volume. Why we just simply use 3 parameters? Because this is more, competitive, and also there are some significant difference. So, and later, for this one, also, because the camera, it's quite small. It's like 5, I can't remember, 5 or 10 centimeters. So we can't use too big scars. So this is also hypertrophic scar. Like the curves, I'm sorry, this because it's still in Chinese, but at least you can enjoy some joins from Chinese characters. So here's the curves. When you try to treat those scars, you are going to, automatically have the curves, and then it's easier to publish. And also here, but this one, can we diagnose this keloid? I don't think so. Still hypertrophic scar, always difficult. And here as well, but this one is also hypertrophic scar from the hand back part. So we also evaluate those pigmentation and also color and also volume. And we can see after treatment, we have the significant difference of all those parameters. And here, it's a scar on the ankle, I think. This age is of, because I don't know, what about your age range or Nielsen in your hospital for pediatric patients? So you do like 14 or 18? Under 18. Okay. We have another joke is for those hospital who deal with the adults, so they think for the kids will be 12 or under 12 or under 14. So in this case, they can take care of those kids because they are happy to see more patients. They think like 16 age should go to their hospital, but for us, we think it's 18 age, 18 years old. Sometimes we have the continuous treatment program for even more than 30, under 35. So that's not a war, I think. Just everybody wants to give better service, and this as well. So just go through some of those more of the hypertrophic scars we can see. But actually, we have quite a lot of this kind of course, this is not from my surgery. If it's me, just like this lady mentioned, if it's for us very professional scar management surgeons, I think we'll definitely, from the beginning, we will do a lot of works to just stop the scar from, increasing and growing fast, more severe. So this one, this is just for example. So we did laser, and also because she is she's go back to our topic is, I mean, she's still too young. I don't want to do too many surgeries and to do too much for anesthesia for her. So we did lasers and compression and sometimes some creams. So we also use part of them used to for those VSS. Of course, when we do the camera evaluation, we calculate the VSS as well. The key findings here is that the height from and the volume, either from VSS also or from the Enter 3D, they decreased. And the vascularity and the pigmentation scores, they showed no significant difference. So from VSS evaluation, you can see only one parameters, two, I'm sorry, height and volume could see the significant difference, but from dermoscopy, here we just use, you see the, I mean, the image, we transfer the red to green, easier to calculate. So the green channel increased means that the volume is decreased. This is from the dermoscopy, but from the 3D evaluation system, we can see pigmentation, vascular, edema, and volume-related parameters are all decreased. It means that more than two, of course more than one as well, we can see the significant difference. It means that this is more comprehensive, so we can have the, even from those two evaluations, normal one, traditional one, we can't see the difference, but from this one we can see. So this is, we call it responsiveness across modalities. So this is our, the whole results of this. Here from this chart, we can see VSS in this case, and here dermoscopy and Enter 3D. And even the same scar, you are going to have the different results of the evaluation. So this study, we have the strengths, I think it's too small to see. We have the pediatric specific cohort addressing and direct comparison of subjective and objective scar assessment. So this is also very useful for pre and post responsiveness analysis for our combined therapy for those scars. And the 3D system highlights sensitive. It's much more sensitive to detect the pigmentation and the vascularity and the volume change. What I mentioned, the 3 parameters. The limitations is that we need to evaluate more, and also because today is for keloids. So later I will definitely use this to evaluate more on, detect more on keloids. So, the same, result-driven interpretation. And here, thank you again for inviting us to be here. We're supposed to have more team because now it's really for, I don't know, for Chinese people, they are we like to travel to Europe too much. So a lot of people, they're applying the visa. So like now we have a small group, like more than 5 supposed to be here, but now only 2 because all of them, they're stopped by the visa application. They can't make it. But next time, and when we go to France, we will, apply in advance, much longer than before. So this is our team, and I will be happy to do some more work for next symposium preparation. Thank you.
Yeah, thank you. Very interesting. Previously, we've reported on doing thermal imaging, which shows temperature and can be indicative of blood flow around. Are you aiming to incorporate that into your system as well?
You mean the blood flow?
No, well, to thermal imaging and get some indication of temperatures around, which in turn indicate some blood flow.
Good idea for the temperature. So, but how can I simply?
If I may make a comment, all these methods of assessing the response to treatment are very important and very good and provide objective evidence. However, to the patients, they don't mean much. You tell a patient your VSS score dropped from 95 to 87, let's celebrate. They don't care about that.
Right.
They want to look at their hip, they want to look at their keloid and say if it is better to their eyes or not. Has it completely gone away or not? Is it better or not?
I do.
How do you deal with that?
I do agree with you, but you know, when you have disagreements, sometimes you say, it's much better than before. And patients, no, I don't think so. Oh, so how to deal with that?
I deal with that showing them the photographs I have taken.
Yeah,
actual
photographs sometimes
photographs.
just to show, it's a flat, not 3D. But when you have you already have the data and there's a look, not only from, of course, I will show the image as well. And I will also add, look, we also have this evaluation, and you see that's the difference.
Thank you so much. Any other questions for Dr. Deng? If there are no questions, I thank you very much. And thank you all of you. Let's have a break and we'll come back in 15 minutes. Thank you very much.